Good evening. Glad you're with us. I'm Kim Fields. We begin tonight with Idaho's new COVID-19 numbers, which just came out about an hour ago. The Gem State reported 904 total COVID-19 cases today. 704 of those cases are confirmed. 164 are considered probable. Since March 2020, more than 210,000 confirmed and probable cases have been reported in Idaho. 7 new deaths were also reported today, bringing the statewide death toll to 2,258. Looking at vaccine data, more than 785,000 Idahoans have received a vaccine. Nearly 77,000 people have only received the first dose of a 2-dose shot, and more than 709,000 Idahoans are fully vaccinated. You can get all the latest COVID-19 updates on ktvb.com. A new model being shared by the Idaho Department of Health and Welfare predicts that Idaho could see 30,000 new cases each week by mid-October. That's more than 4,000 new cases every single day. A report from Melissa Davlin of Idaho Reports says Health and Welfare's Division of Public Health is presenting these projections to local and state officials. And those projections were just one of many things discussed on today's COVID-19 media briefing with the Idaho Department of Health and Welfare. Our Shira Matsuzawa was on that call. She joins us now to walk us through what we at home need to know. Shira?
Well, Kim, those projections you just mentioned stem from the fact that the vaccination rate in Idaho is less than 70%, and Health and Welfare say the Delta variant is 60% more transmissible than the Alpha variant, which we saw last winter. Dr. Kathryn Turner says based on what they're seeing right now, we could be in for a very, quote, grim winter, or at least a grim fall.
We continue to be extremely alarmed by the increasing trends we're seeing in Idaho.
Those trends include rising COVID cases and an increase in hospitalizations.
Very discouraging news for us all.
During Tuesday's COVID-19 media briefing, Dr. Kathryn Turner says we're seeing a significant increase when it comes to people in the hospital with either suspected or confirmed COVID-19.
And when you look at our data, what you will notice is that we are not just repeating the surge that we saw in the summer of 2020. We're actually beating that surge, and we are inching more towards the surge that we saw last winter. If current projections continue, we could be reaching those levels here in the next few weeks.
That increase includes the number of people in the ICU. Dr. Turner says we're currently at the peak that we were at last winter. As a result, Public Health Administrator Elke Shaw-Tolik says our hospitals are completely stressed and overwhelmed. So much so, the Department of Health and Welfare submitted emergency assistance requests to bring staff in from federal sources. They've also called on the Crisis Standard of Care Activation Committee to convene later this week to ensure they are fully trained and ready to activate crisis standards of care on a moment's notice.
As a reminder, crisis standards of care is when a substantial change in the usual healthcare operations is necessary due to a pervasive or catastrophic disaster.
All this as cases have been increasing in every region of the state over the last 4 weeks.
2 weeks ago, we told you we had not seen numbers like this since January and March of this year. Now we're seeing numbers like our hospitalizations, for example, closer to what we saw near our highest peaks in November and December.
She adds currently only 3 counties have a 7-day moving average under 10 cases per 100,000. So at what point do state health leaders make recommendations to the governor about possible statewide mandates or even perhaps moving back a stage?
We do continually review all of the metrics that we've had in place since day one. And he is taking all that into consideration. And certainly as we look at our healthcare capacity and consider the stage that we're in with healthcare, and if we are indeed having to move to crisis standards of care, those would all certainly be some game changers.
Also, keep in mind, a year ago, we didn't have the vaccine, which experts call the biggest tool in the fight against COVID-19. And vaccination rates have increased slightly over the last 4 weeks, which they say is encouraging, but they'd like to see more. And something else interesting that came out of today's meeting, Elke Shaw-Tolik revealed there's a hospital in North Idaho that has 500 open positions. Normally, they have about 200 open, and it's not because they're requiring vaccinations, but because she says they're burned out and leaving the profession. Kim?
500 open positions.
500.
Wow.
It's
All right.
unbelievable.